So aside from hospitalizations, the other reasons why I would go see a doctor would be for my eyes. So I have to go get an eye exam every year, and this is not just like a regular eye exam to test your seeing. It's a specialist. So it's not one of those doctors that's just automatically covered under insurance because she's considered a specialist because she's looking for a special like retinopathy when she's doing her work. So I have to go there once a year, and that's something that is definitely extremely important because of the risks associated with sickle cell with the eyes. Then also I have to, of course, go to a gynecologist once a year. Usually it's once a year, but sometimes it can be more. And because with sickle cell, our immune system is not as good as other people, we're more prone to infection. So I'm more susceptible to getting like a urinary tract infection or a yeast infection or a bacterial infection. And so that's going to increase how much I have to go to the gynecologist and then how much I'm paying out of pocket for those treatments to clear that infection. And then also you have the dentist, because even with sickle cell, you can have issues with your gums and your teeth. So going to the dentist twice a year. So that's another expense you have to think about. And so I also have a history of avascular necrosis. I had a hip replacement when I was 15 years old, so a left hip replacement. And with that, I still, so in other parts of my body, I tend to suffer from like soreness or stiffness. And so I've had to see a physical therapist. Last year I did physical therapy for some time, and it's covered under insurance, but there's like a high copay for it because I don't think insurance companies look at physical therapy as something that's necessarily a necessity. Also, I forgot to mention, I went to Africa a couple years ago, and I was really scared and concerned because I have sickle cell, and so I was like, I don't know how I'm going to do on the plane, because when you're on a plane, you're up in the air, oxygen is a lot lower, and so for sickle cell, that's a big red flag. And so, so I called my doctor, and I was like, I want to get oxygen for on the plane. And so she said, okay, I'll write you a prescription to get the oxygen. So the way she wrote the prescription, when I presented it to my insurance company, they were like, well, this is not really a medical necessity because sitting here right now, I don't need the oxygen. So they're saying if you don't need it just sitting in a room, then it's not a necessity. To them, it was just something that I was doing for precautionary, so they didn't cover it. So I had to come out of pocket because I did it for peace of mind to have the oxygen while I was on the plane because it was like a 12-hour flight. So I did it for peace of mind that if I needed it, I would have it. And so that cost me like $400 for that oxygen to have. But I was so concerned that I did it anyway. And then with all the appointments that you have to go to, you still have to go see your hematologist once or twice a year. And if you don't, they're not going to write you a prescription. So a couple years, I say, well, I'm going to skip this appointment because I might not have the time to take off of work. I might not want to have another bill to pay. But then you might get sick 9 months later. Well, we haven't seen you in a while, Miss Moore, so we can't write you a prescription. You need to come in to be seen. So it's almost like you're penalized because you don't come in that often, but you have to still come in because if you want a prescription when you do get sick, they have to be able to say that they saw you. So with the hematologist appointment, your primary care doctor, you have a gynecologist, you have eye doctor, you have a dentist. All those appointments have to be done during the day when you're working, so you're taking time off, so you're spending money there out of your accrued vacation or sick time, so that's money coming out of your pocket. And then, so yeah, taking time off, yeah. And sometimes what I try to do is I try to schedule all my appointments as much as I can in the same day, so I'm not taking as much time off. And lastly, I would talk about when I was pregnant with my daughter. Of course, it was a high-risk pregnancy, so I had to go to the doctor more often during my pregnancy. So every time you go into the doctor, you're paying a bill, you're paying a bill, you're paying a bill, and you're getting a sonogram done typically every single time. So anytime you're getting imaging or radiation, like for x-rays, not for sonogram, it's more expensive. So my experience when I had my daughter, I got an epidural, and like the most expensive part usually of being in the hospital is anesthesiologists. They're very expensive. So I got this epidural and it didn't work. And I wanted a refund, but of course they weren't going to do that. But it didn't work. I still could feel the contractions. And then they told me after the fact, oh, they were kind of puzzled, like baffled as to why the epidural didn't work. And so they came to the conclusion that, oh, it's because you have sickle cell and the pain opioids in your body is making it harder for this to work. And so then when you have sickle cell, your child is more susceptible to be born at a lower birth weight, which my daughter was born at a lower birth weight. So she had to stay in the NICU for 4 days, which is another extremely expensive bill. And then when I was going through labor, I had to get a blood transfusion, so that's more money on top of that. Had to be put on oxygen, so that's more money. So all those things that a person who does not have sickle cell may not have to go through when they're delivering a baby is just extra expenses that we had to go through. And then just having my daughter in the NICU, going back and forth to the hospital, that became like a strain.